A disturbing discovery last week reignites the discussion surrounding women's health care here in Oklahoma. This after a fetus was found in a residence hall at Northeastern State University. The university says a student came forward to seek medical attention. And while we don't know anything else surrounding what exactly happened here, a new report card ranks Oklahoma near the bottom when it comes to women's health care. News Channel 8's Ryan Stockett reports.
Well, Fund published a state scorecard on women's health and reproductive care, ranking Oklahoma at 48 in how its healthcare system is working for women.
Oklahoma has been ranked very low for years. As far as I've been a labor nurse and been in the maternity care force since 2004. And part of the problem that we're seeing is that we have less maternity care providers per capita than many of the other states.
Emily Wales with Planned Parenthood says that one factor in this ranking has to do with the state's abortion ban.
Where you have an abortion ban, physicians are often concerned about providing even life-saving measures to women who are pregnant. So when we look at maternal mortality rates, the map of states where maternal mortality rates are very high, concerningly high, often overlaps almost exactly with the map of states that have abortion bans in effect.
Wales says one reason for this overlap is because providers are scared to go to states where abortion is banned.
Patients and providers feel scared about what their options are, about accessing care. The culture of fear when it comes to reproductive health is very real.
Sarah Foster with Tulsa Birth Center says there's a gray area on the spectrum of where it is dangerous to be a healthcare provider working with pregnant women because pregnancy doesn't always go to formula. Foster says that when you have laws that potentially criminalize what would be a legitimate healthcare intervention, that gets terrifying for doctors. And she says that physicians' clinical judgment is being curtailed.
It's hard to disprove if you took any action that miscarriage would be caused by you. Physicians are reporting that they are having to wait until it is clear that it's a life and death situation, even though by their clinical judgment, it was already a life and death situation. And so that puts them in jeopardy on both sides.
Foster says that when you have laws that potentially criminalize what would be a legitimate healthcare intervention, that gets terrifying for doctors. And she says that physicians' clinical judgment is being curtailed.
There's no incentive for somebody to put themselves in between the rock and the hard place.